Welcome to This is Getting Old, Moving Towards an Age-Friendly World. I'm your host, Melissa Batchelor, and today I'm going to be sharing with you 10 tips for preventing Alzheimer's disease. So Alzheimer's disease is the sixth leading cause of death for people that are over 65. In fact, 1 in 3 Americans will die with Alzheimer's disease or some other form of dementia. And of the top 10 leading causes of death, it's the only one that we can't prevent 100%. We can't slow it down once you are diagnosed, and we haven't cured it. So there have been no survivors of anyone ever diagnosed with Alzheimer's until we have a major medical breakthrough. And while getting older is the biggest risk factor, including your gender and your genetics, those are things that you can't really control, but your biggest risk factors are your lifestyle choices, and those are called modifiable risk factors. So we can do something about those. And so I wanted to share 10 tips to do your very best to prevent and make sure that you don't end up with Alzheimer's disease. So the first tip is that you need to stay active. So being physically active and having an active lifestyle is important. And I will tell you, I went to a conference probably 4 or 5 years ago now, and the guy was presenting on the blue zones, and the number one tip for the blue zones was to move naturally. And to me, that was a great relief because it means that I don't need to be out there training for a marathon. I don't need to be hitting the gym every day. What I need to be doing is making sure that I'm getting my 10,000 steps in a day and doing some type of strength and flexibility exercise in my daily life. So when you are moving, whether it's moving around your house, whether it's walking around the block, all of those things can help because there have been several studies that have associated the amount of physical activity that you have in a day. It does reduce your risk for getting Alzheimer's disease. The second tip is to stay connected. And in the middle of a pandemic, this has been a little bit more challenging for all of us. But making sure that you're staying connected to your family, friends, and your community is important because if you're not doing that, then you are socially isolated, which all of us have experienced. And social isolation is the equivalent to smoking a pack of cigarettes a day. So if you can't see people face to face, and you may not be able to volunteer as much right now, look into some other virtual options. And I did a podcast on Well Connected, which is a program that can help people connect online. But also, if you only have a landline, you can sign up for this program and do virtual museum tours. You can participate in support groups, and you can listen in on educational programming. Which brings me to tip number 3. And that is to learn new things. So we've all heard the phrase use it or lose it, but it is important to challenge and activate your mind. So you can do this in a couple of different ways through formal education. So you could take a class at a community college, and a lot of courses these days are online. So it means you wouldn't even have to go in. But learning other new skills is also important. So learning how to use the internet, learning how to use your smartphone or a tablet or your computer. I know that the Apple Store offers free classes that will show you how to use their products, and I'm sure that other smartphone companies do that as well. So formal education, learning new skills, but also picking up a new hobby. So maybe there's something that you've always wanted to learn how to do, maybe play the guitar. You could use your smartphone to learn how to do photography if you don't have a regular camera. But even working, a jigsaw puzzle or doing something creative, all of those things keep your mind active and engaged. Tip number 4 is to get enough sleep. And I know this used to be more difficult for me when I was trying to commute in and out to work, but making sure that you are getting enough sleep, because I'm sure you've all had the experience that if you didn't get enough sleep, that's going to impact your ability to think, and it's going to cause trouble with your memory. So probably my biggest experience with that was during nursing school and having to study quite a bit. So being aware that there are some common sleep changes, but also thinking about, is there an underlying reason for why you're not getting as much sleep? So are you having trouble getting to sleep or falling asleep? Those could be signs of depression or anxiety. Are you experiencing sleep apnea or restless leg? So if you are having any trouble with your sleep or not waking up rested and refreshed, that would be worth having a conversation with your primary care provider. Tip number 5, you need to eat and drink well. And again, this is not, all that hard to do. Making sure that the things that you're eating, that they're heart healthy, that they're non-processed, and that the other thing that I typically think about is making sure that I have a plant slant. So if you're not sure if a food is processed, I can remember from like either Sesame Street or some type of show that I watched as a kid, they were like, if you don't recognize the food for what it is, then that's not like a natural food. So, and also foods that come in their own containers. So things like bananas and oranges and grapes, we know what those things are. And typically thinking about, these foods are also typically around the perimeter of your grocery store. So that's how you can eat non-processed foods, making sure that you can recognize it, but also being aware of how much you eat. Obesity is a risk factor for developing Alzheimer's disease, and so you want to be sure that you're maintaining a healthy weight. So far as like things to drink, make sure that you're drinking more water than soda. And if you don't really like water, there are a lot of water flavoring that you can add to your water, or even just switching to carbonated sparkling water. That's been one thing that I've done. And then limiting alcohol. So moderate drinking, which is defined as 1 drink a day for women or 2 drinks a day for men, has been shown to reduce some risk of Alzheimer's. But if you don't drink, it doesn't mean that you should start drinking, and making sure that you're not kind of moving up into the heavy drinking category, which is 3 to 5 drinks per day, because that increases your risk for having memory problems. It also increases your risk for having accidents to end up with an injury, and can damage other organs like your liver, your kidneys, as well as your brain. So speaking of that, tip number 6 is safety first. And if you have a traumatic brain injury, that increases your risk for developing Alzheimer's disease. So it's important to do things like wearing your seatbelt. Also, if you're going to ride a bike or participate in contact sports, to wear a helmet. So to make sure that you can avoid concussions or a more significant form of traumatic brain injury. The other thing is learning how to prevent falls. 1 in 4 Americans fall every year, and they're the leading cause of death for both fatal and non-fatal injuries for people that are 65 and older. So looking around your home to make sure that you have pulled up throw rugs out of your floor, that you have grab bars in places. And on the website, I've linked a lot of other strategies to help you to prevent falls. Or tip number 7, if you are smoking, you need to stop. And and then don't start smoking if you're a young person listening to this. But cigarette smoking increases your risk for developing Alzheimer's disease. And it doesn't matter how old you are, quitting smoking can reduce your risk at any age. In fact, after a year or 2 of not smoking, your risk factor goes right back to the same level that's comparable to people who never smoked. So while I know that can be difficult if you're a lifelong smoker, it is beneficial to stop no matter what age you are. So tip number 8 is to see your primary care provider. And the reason this is important is because that you need to have an annual wellness exam where you have blood work done and a memory screening. When you're 65 years old and you are first coming on to Medicare, you are entitled to the Welcome to Medicare visits, as well as an annual wellness visit. And I highly encourage you to get these annual wellness exams and to be aware of the 10 signs of Alzheimer's disease. So I did a podcast on that as well that I'll link to the blog for this one. And knowing what questions to ask so that you know if you do need to be screened for your memory. So those are important things to do. So tip number 9 is to know your numbers. And this is important because there are a lot of chronic illnesses that increase your risk for developing Alzheimer's disease. So things like obesity, high blood pressure, diabetes, and heart disease, all of those things increase your risk. And so the numbers that you need to know that you can get from your primary care provider when you do your annual wellness visit is to know what your cholesterol level is and what are some things that you need to do to keep that in the range that it needs to be. what is your blood pressure, and making sure that if you do have high blood pressure that you're checking it at least once a week, and that you're coordinating with your primary care provider to make sure that you're maintaining a healthy blood pressure. Also knowing your blood sugar or your hemoglobin A1C. That's the one marker that tells us what your blood sugar has been doing over the past 3 months. And if you are a diabetic, to make sure that you're maintaining your blood sugar levels at a healthy number, but also your body mass index. And so this has to do with, are you maintaining a normal weight, or are you moving into a stage of obesity? In middle adulthood, um, gaining weight at that point in your life actually can increase your risk for developing heart disease. So it is important to, throughout your life, to maintain a normal body mass index. And number 10, to mind your medications. And when people are 65 and older, the average number of medications that they take is 5, and that's for your prescription drugs. And so knowing what medications you're taking, what dose you're supposed to be on, and you need to know what they're for, because sometimes medications, a lot of people see different providers and they might not have a primary care provider who's doing what we call a medication reconciliation, which is where you look and make sure that for every drug or medication somebody's taking, that there is an active medical diagnosis to support that. So take all of your medications. It's called a brown bag approach in geriatrics, where you take all of your prescription medications and all of your over-the-counter vitamins and supplements, put all that in a brown bag and take it to your primary care provider so that they can look at everything that you're taking. And maybe they can even de-prescribe some of these things. So making sure that if you have a medication that doesn't have an active diagnosis, you shouldn't be taking it. And then the other thing is to keep in mind is what over-the-counter medications you're taking, and being sure that you talk to your primary care provider or your pharmacist before you add anything or abruptly stop anything. So those are 10 tips to help you do your best at preventing getting Alzheimer's disease. And I thank you for listening. Thanks.
Thank you for joining me today for This is Getting Old. If you'd like to know more, you can subscribe to my YouTube channel. And if you have any questions or a related topic you'd like to hear from me about, just let me know. Thanks.